So I'm delighted to welcome our London and Hong Kong regional advisor, who will be talking today about how to set up a travel clinic. We'll also have a short question and answer session at the end with plenty of time if you've got any questions. So please do use the Q&A chat functionality, which is on the left-hand side of your screen, and we will address your questions at the end of the session. So it's a great pleasure to introduce Alex Leung, who's a pharmacist, an entrepreneur, and a superb teacher. Alex is the founder member and president of the Hong Kong Society of Immunisation and Travel Medicine, and has hosted conferences in Hong Kong for travel medicine. He's also an advanced life support instructor and a pet first aid instructor, which means that he can perform CPR on a dog or a cat. And in his spare time, he's a special constable in London, which is like our Gotham City. So, without further ado, I'm going to hand over to Alex.
Good evening, everyone. My name is Alex. I'm one of the London advisor for travel medicine for the Royal College. So I have been working in travel medicine for the past 15 years, and I'm the head of travel medicine and immunization service of ACUS and ACUFU surgery in Northwest London. So just give you a bit of background. I was the program chair for the first pharmacist travel medicine conference at UCL back in 2018, and also the conference chair between the RPS and the Royal College of Physicians and Surgeons of Glasgow travel medicine conference back in 2019. And I serve as a London advisor for travel medicine since 2019, and I'm the module lead for Module 7 for postgraduate diploma for travel medicine. I'm also the examiner for the postgraduate diploma of travel medicine, and currently also just have an additional role as the Hong Kong advisor for travel medicine. Professionally, in other regions, I'm a lecturer for the Chinese University of Hong Kong, and also I'm the president of Hong Kong Immunization Society of Immunization and Travel Medicine, HKSITM. So to date, I have educated 4,000 pharmacists in travel medicine through PGD accreditation and 12,000 vaccinator in advanced immunization techniques in the world. Through the network for Hong Kong Society of Immunization and Travel Medicine, I'm a strong advocate for public health program for implementing travel health consultation and risk assessment for every travelers in Hong Kong healthcare system. So today, I just want to give you a overview of how to set up a specialist travel clinic through CQC and the GPXC route. This is intended as a guide, but at the same time, if you want more further information, feel free to email myself. I'm happy to support you. So first of all, I would like to start with the pharmacy side. This is the pharmacy route, DSP or private pharmacy. So there is two options for you to set up a pharmacy. The reason why we set up the pharmacy, we can supply medications rather than just administer medication. There's two options. One is DSP, one is private pharmacy. DSP is providing remote consultation. However, under current legislation, you can provide face-to-face consultation as well. This provides flexibility, patient engagement. And the requirement is you need to have a compliance website with the GPXC if you provide this route. At the same time, private pharmacy, if you prefer to more face-to-face consultation, but at the same time, this is where it's confusing. You can still provide remote consultation if needed under current regulation. But simpler way is distance selling pharmacy, usually remote consultation, private pharmacy, usually face-to-face consultation. And under this current CQC license requirement, because for the GPXC is for more for the pharmacist travel clinic, for the doctors, nurses, dentists to run a travel clinic, you need to obtain a CQC license. For the but when you set up a pharmacy travel clinic, you need to appoint a superintendent because that is like an overall hierarchy for the clinical governance, as well as you need to appoint a responsible pharmacist to oversee the supply of medications on day-to-day basis. And the role of superintendent and responsible pharmacist can be the same person or different. I would like to talk about a bit about the off-license medication supply, because that is going into a bit more technical. So let me just go through the route for the CQC registration. So if you are non-pharmacist, you need to set up CQC license. First of all, you go through Regulation 15. It's about space and also hygiene, cleanliness, infection control, storage requirement. And then you need to go through health and safety compliance, COSHT, and also fire safety, electrical safety. And then you need to go through infection control measure. This is the NHS cleaning standard document in 2021. And then you also have the handling or storage of hazard substance under COSHT regulations. To be honest, that's quite a lot of inspection requirement, which you need to prepare before the inspection. And then you have the governance policies, health and safety policy tailored under clinical risk. And then you have incident reporting and then emergency procedures. We can share the presentation if you need it to look through the details. And then in terms of staff training and management, under Regulation 7, you need to have a registered manager under CQC and also adequate staff training, fit and proper person requirement for Regulation 5. All the directors of this company, which is for this CQC premises, must be passed the DBS check and also other qualification check. And in terms of medicine and vaccines administration and storage, Regulation 12 about safe care and treatment, medicine must be stored securely at correct temperature. Vaccines fridged must be validated. So all those requirements and COSHT as well for disinfectant, sharp bins, and cleaning agent. And then you have patient safety and experience. So duty of care, Regulation 20, openness with patient. It's about compliance. It's about complaint procedures. It's about how to capture feedback. So those are under that. And also you need to display your CQC rating on the premises on the website under Regulation 20A. So a lot of information, but I just summarized that in a roadmap. So first of all, you need to check for your premises whether it's suitable for as a CQC premises. That could be also about the classification of the buildings as well, the licensing. And then you have the governance package. So about policy, COSHT, safeguarding, health and safety, fire safety, incident reporting, and also staffing. You must be appointed a registered manager for overall responsibility on governance. And then you have the medicine management for vaccines, fridge, SOPs, PGD, and prescribing. So this is about the clinical procedures. And then you can apply the CQC classification under treatment of disease or disorder of injuries. And then you have the inspection ready. Usually what we do is we normally have a checklist for us, and then we have multiple mock inspection just to make sure we are compliant, or any unexpected questions will be raised by the CQC inspector. We need to be ready for that as well. Okay, I have mentioned about the off-license prescribing. Because Diamox is a sozolamide, is commonly used to prevent reduced symptoms of altitude sickness by accelerating the acclimatizations for the body to high altitude. The license indication for this treatment for Diamox is for glaucoma. For AMS, is considered as off-license. When we're prescribing Diamox for a travel clinic, it is essential to ensure that your professional indemnity to cover for this off-license prescribing, because if something happened, because this is not as intent product license indications, is under more like an expert opinion or expert treatment. So that will be directly under the prescriber. And also the prescriber must have the correct qualifications for this type of prescribing, such as our Royal College for Physician Surgeon Glasgow postgraduate diploma for travel medicine, and also for the International Postgraduate Diploma of Expedition and Wilderness Medicine as well. So you can join us for the education side. Okay, it's just a very quick case for the because obviously pharmacists, nurses, doctors are traditionally running travel clinic, but for dentists, this is gone through a journey. I'm proud to say that I have supported one of the first dentists to become a travel clinic back in 2017, or actually 18, and then just before COVID, he has successfully set up his her travel clinic. However, she faced severe scrutiny by the NAFNEC because she wanted to set up a yellow fever center. And what happened is, at the time, NAFNEC do not agree that a dentist should able to provide a yellow fever center vaccination. So we actually help her step by step how to overcome those problem. It takes a while. It's not actually quite straightforward. I'll just share with you what happened. So first off, some legal basis. So under Medicine Act 1968 and also Human Medicine Regulation 2012, dentists are appropriate practitioner and can issue NHS private prescription. They are, but also NHS side limit to dental practitioner formulary, but the private prescribing side, dentists may prescribe, including vaccination under the patient best interest and within the professional competencies. This is where a bit tricky. GTC standard, dentists must prescribe only within their competencies. Prescribing outside the usual dental scope require evidence of appropriate training, indemnity, and competency. So basically what we did is we provide necessary training for the dentist. We provide a PGD for the dentist because direct prescribing at that time is a bit gray area. But now I think it's a bit more clearer. But still, I think if you are a dentist, you want to set up your travel clinic, I suggest you clarify with your insurance provider and also your GDC regulator for direct support. But obviously, there is a lot of governance process like coaching management, anaphylaxis management, professional indemnity. I know there's 2 major insurance providers for dentists, and also CQC registration is required because the dentist cannot directly work in the GPHC premises. So if a dentist want to provide medication like anti-malarial, basically you need to set a pharmacy. At the same time, the pharmacy need to employ a superintendent pharmacist, and the superintendent pharmacist could be the RP responsible pharmacist as well. They could be the same person or different person, which we have highlighted before. Dentists can legally issue private prescriptions for travel vaccination, provided they have the relevant training and within the scope of practice. So this is a gray area which requires further evidence to prove that you are competent. So yellow fever vaccination is a special consideration because on top of the regulation for Medicine Act, you also have the additional qualification for the pharmacy or the CQC premises to become a yellow fever center. This is for the center. On top of that, you need to make sure the practitioner, which is the dentist, can also yellow fever center trained. So one of my students who was a dentist received the NAFNET training back in 2019. And then it was a face-to-face training at that time. Now everything is like a virtual face-to-face classroom training. So that was back in the old days that you can still go to ECH to receive your face-to-face training if you're from London side. And yellow fever vaccines, just recap, is a POM, but at the same time, because of the World Health Organization special international law for governing yellow fever vaccinations certification system, this require additional training and additional licensing for the premises. So, take-home message. I want to make sure all of us, when we set up a specialist travel clinic, first of all, if you're a pharmacist, you can set up as a travel clinic under the pharmacy side, under DSP or private pharmacy. It is still a bit confusing. So what is the difference between DSP and private pharmacy? But at the moment, I think they could be classified at a similar sense. But obviously, when we cannot assume that regulation cannot be changed in the future. But in terms of the non-pharmacists, which is doctors, nurses, and also for dentists, you need to have your CQC registration sorted first. And if you want to supply medications either remotely or in face-to-face sense, you must set up a private pharmacy or DSP to enable that supply. So that is my key message for everyone. If you have any questions, feel free to ask me directly. Thank you.
Excellent. Thank you very much, Alex. Well, that was a lot of information. Please, for those who are online, do submit your questions if you have any. And can I just to get the ball rolling? So can I just check if a dentist can administer yellow fever vaccine in the UK?
Yeah, absolutely, yes. So it was quite gray area before 2023, but since there is a lot of requests, and also we have provide further evidence from the GDC, also from several dentists, NAFNAC have finally agreed that dentists should be the appropriate practitioner to able to administer yellow fever vaccination. So if you go to apply for NAFNAC, you can see the correct healthcare professional who can administer yellow fever vaccines are doctors, pharmacists, nurses, and also dentists.
Oh, that's great. And both nurses and dentists can dispense then from.
So this is where it will be technical, because under the CQC premises, you cannot you can administer medicine, but you cannot supply. Supply would be still under the pharmacy side, unless there's a TTA, but this is TTA will be another legislation. So on the pharmacy side, so if a dentist or nurses or doctors want to supply, they need to register a pharmacy. So they need to employ a superintendent and also employ a responsible pharmacist. It could be the same person as well. So it's a bit indirect, but nurses, dentists, and doctors can own a pharmacy to able to supply medication.
Okay, great. And then there's a question from Aman. I think it's Abdullah here. Can a nutritionist set up a travel clinic?
Oh, so that is a good question. So under the MHRA regulation, that is certain professional can use PGD. So PGD is patient group directions. So under that direction, you can. I need to double check. I think nutritionists may be on that list, but I need to double check myself. So even if the practitioner is on the list, it may go through the similar journey as the dentist, that you need to able to provide further evidence that you can administer vaccination, or so that will require further check. But I think as long as it's on the PG on the appropriate practitioner use PGD, I think that is okay. But that will be something we need to check. If Abdullah can send me further information, I can check for you.
Yes, thank you. That is Aman, wasn't it, who asked that question? Okay. Yeah. And what about the DSP and private pharmacies? Are they in the same category?
So this is where is it interesting. At the moment, if you just see from superficially from the functionality, it can be the same, because as I said in the presentation, DSP, although it's majorly for remote consultation, but it can be provide face-to-face. Private pharmacy, majorly for face-to-face, but can they provide remote consultation? The reason why we have this similarity is used to be we can able to apply NHS contract through DSP pharmacy license, but that has ended on the 23rd of June this year. So without that, so DSP used to able to run NHS contract, which private pharmacy cannot run NHS contract. But now that difference has been gone. So at the moment, they are under the similar function, but I'm not sure whether the regulator or the NHS England will change that differences in the future. So we will wait and see. But we done a lot of extra investigation in terms of the legislation, the framework, enable for pharmacists or other healthcare professionals can fully utilize the functionality of the license to able to set up a specialist travel clinic.
Well, thank you, Alex. We've got questions coming in now. So Jima Al-Said asks, are you expecting a change in the GPHC regulation regarding face-to-face services such as travel clinics?
We at the moment we don't see too much emphasis on travel clinic. Now the focus is on weight management, but obviously when travel clinic we become more and more popular, which is popular now, I think certain regulation may need to be tightened. But travel clinic majorly because we administer vaccination, So that face-to-face nature remain the same. But obviously, for travel clinic, as we said in the presentation, there's additional functionality such as able to supply Diamox or supply antimalarial or supply other travel health medicines. So that will be the distant element, although the consultation can be both face-to-face or remote. So there's a lot of crossover in terms of the regulation. But at the moment, I don't expect there's any major changes of the face-to-face element for travel clinic.
Super. And as a general question, what are the sort of startup costs for starting your own pharmacy?
Okay.
Hidden costs to take into account.
I see. So first of all, there's an application form you need to fill in. I remember is I think actually I can't remember from the top of my head. So it's under £1,000, but that is the application form. And then after that, obviously you need to register, rent a premises. That could be a long-term commitment, or you can actually shop for a short-term rental. The problem is you need to give the regulator a signed contract, and that contract could be leading to long-term commitment. So rental, application form, and also you might need to go through a lot of SOPs. So those SOPs you can do it by yourself if you're a pharmacist, or you can do it by a specialist. So that's for the pharmacy route, and also I think the CQC route will be similar, but I think the cost may be slightly higher. So there is multiple options for you to set up costing wise. I think maybe £2,000 to £3,000 as a startup, but you need to order medication as well. You need to order vaccines, and those are additional costs. Depends on the size of your operation. I will reserve another £2,000 to £3,000 for just ordering of vaccines, and I think 10,000 will be my basic startup cost for starting a travel clinic. Could be lower because you want to have a healthy stock level for each vaccines in case there is any shortage. But most ordering account you can order for next day delivery. So if you want to maintain your cost load, that is possible as well.
So different to people who are setting up clinics for weight reduction, because that can be online, presumably. I guess there are lots of private.
Yes, I think weight management is. Yeah, I think the regulation will be similar, but at the same time, I think there's some additional regulatory monitoring for weight management, which is not at the moment under travel clinic.
No. Well, that's super. Great. A couple of public service announcements whilst we're speaking, but please put in further questions if there are any pressing questions to come in. But to remind you all that the annual conference of the Faculty of Travel Medicine will take place a week on Thursday. That's the 9th of October. Please register. There's a link in the chat there to do your booking. Got a fantastic lineup of speakers covering everything from expedition medicine, and this year's Livingston lecture will be on topic of will cover people smuggling, and so it should be a very interesting day. Also, for your diary, please make a note of the next webinar for the Let's Talk Travel Health, which will be Tuesday, the 28th of October. I call this the Italian job because we'll have Andrea Rosanese giving us some cases from Italy. That's Tuesday, the 28th of October. Then after that, we've got Monday, the 24th of November. And the final one, which might be a special one, on Thursday, the 11th of December. So that's Tuesday, the 28th of October, lunchtime talk. Monday, the 24th of November. And finally, Thursday, the 11th of December. So if there are no more questions, I would like to thank our esteemed speaker, Alex Leung, for an excellent talk on how to set up a travel clinic. And thank you for joining us, and look forward to seeing you all in the next webinar or at the annual conference at the college. Thank you.
Thank you.